My name is Jan Vanderzalm. I'm from Volga, South Dakota originally. I now reside in Brookings. I was gone for 30 years in the Foreign Service overseas, and after I retired, I came back to Brookings, and I've been here about 5 years. Well, I just turned 70. I've never had a bone density scan, and my mother had terrible osteoporosis and broke bones almost, several a year. So I was a little worried about it, and when she suggested I do it, I said absolutely. My mother, well, she just passed, but she was 96, and for the last 20 years, she just was falling and breaking things, and she'd been on medication for it for at least 20 years when she passed. But I didn't want that to happen to me, so when Dr. Cruz suggested the bone density, I jumped at it and said absolutely. I went into the hospital here to the southeast entrance. The lady came and got me. She took my height because you have to adjust the machine, and then she had me lay on a bench, and then they did the scan. It took 5 minutes at the most. It was just a piece of cake. I mean, don't have to change your clothes. You lay on a table for 5 minutes and you're done and you're gone. So no reason not to do it. She was wonderful. She explained every part of the procedure, why she took my height, why I didn't have to change my clothes, what was going to happen, how long it would be before I got the results. She was really, really nice. Well, actually, they were really good, I think. I had a little bone thinning in the hips, but there was only 4.8% chance of me breaking a hip, which I think is fabulous. The rest of my bones, there was an 18% chance. But, I'll rather have a break an arm than a hip, so I was happy with that too. She recommended I start a calcium regime and vitamin D, and that's all I had to do, and walk, get as much exercise as I can. I would say do it as soon as possible, because the sooner you know whether you need medicine or preventative treatment, the better. Because like with my mother, it was too late. And she kept breaking things. And if she would have had the test a lot earlier, they could have probably prevented a lot of her breaking bones. Well, it's just so convenient. I mean, if I had to drive to Sioux Falls for every doctor's appointment or Madison, I'd think twice about doing it. I have no compunction about coming in here because it's so convenient. I do not want to drive an hour for 5 minutes. They have been friendly, they've been informative, efficient. I couldn't be happier with my health care in Brookings, because I have had nothing but good experiences with Brookings Healthcare. Nothing. I have no complaints at all.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.